Hi, this is varicocele surgery failure, part 413. My visit to Men's Health Institute in Toronto and my appointment with Dr. Jarvi. I'd like to thank Dr. Jarvi very much and point out that there's this video, I guess, is basically pointing out the terrible difference between Dr. Jarvi's treatment and Dr. Milner saying all he could do is cut off the left testicle, and Dr. McMahon claiming that I did not have a urological problem. If you're watching this and you've had similar treatment or just similar symptoms, you can email me privately at grade4varicocele@outlook.com. I'll be showing that in the table of contents, or you can share publicly on Facebook at grade4varicocele and see more of my postings there. I really think that a lot of men are in a lot of pain in the spine and abdomen because of the varicocele. Very low percentage, but adding it up, I think those of us with more extreme problems are having a lot of problems. But when surgery doesn't work, surgeons try to blame the patient's spine or psychological health for their pain and to cover up the urologist's mistakes or the surgery mistakes. The surgery does fail. It's not necessarily a fault of the urologist. Well, I don't want to get into that right now, but I want to thank Dr. Jarvi for his honesty that he said there are no guarantees with the surgery. He acknowledges the diagnostic dilemma, and that's the title of one of his papers, Varicocele, the Diagnostic Dilemma. So here's the table of contents on my series on varicocele surgery failure, and my Facebook sites that you can look at. Hit pause if you want to look at this. I'm very sorry about the quality of this video, but I have a lot of difficulty doing the videos and even just moving around. Alright, here's the part 1. Shows a venogram and why inguinal surgery fails. And part 4 is my story. Part 6 is a series on scrotal pain. So now I'll just continue with telling you about my appointment. It was very different from the way I've been treated here in Manitoba. So I was very happy with how the appointment went. The result was just as I thought. The diagnosis was bilateral varicocele. Dr. Jarvi said that he could not do microsurgery because of the scar tissue in the inguinal canal from the first surgery. He said that embolization, they'd do embolization surgery by sticking a tube down through my neck and then would embolize the veins going all the way down to the testicles. And they'd embolize the veins below the original surgery, then above it. Then they would also do the right side. They would do a venogram just before the surgery, and he could not guarantee success. So this is how the appointment went. We greeted each other, and I told him that I had read his articles, Varicocele, the Diagnostic Dilemma, and Scrotal Pain, a Common but Poorly Understood Condition. He asked some questions, and I answered them while he was on the computer looking for my surgery report. I showed him the underside standing photo I had shown to Dr. McMahon. You can see that in video 6. I showed him other photos as I answered his questions. I remained quiet while he found and read Dr. Milner's 2008 surgery report. You can see that in video 1. I don't know what else he read, but he was quietly reading for a few minutes. I had given him like the Mayo Clinic report that I've shown and a few other things. I explained and he listened carefully to my shower story and how we discovered the varicocele in the first place after I put on a hockey jock strap and fell to the floor when I took it off for a shower. You can see that story on video 4. I also explained the stiffness I had middle distance running when I was 29 and still feel now. It's difficult to squeeze the pelvic floor and hips in general, especially the left side. This is all in part 4 of my story. I explained my back problems bus driving. He empathized with my back problems and difficulty discerning where the pain is coming from because the back, hip, and groin are in the same area. but definitely sometimes I feel pain in the right where the veins enter the body. Also, my SI joints, lumbar and abdominals are very stiff at times. It's positional, I said, and it depends on my activity. That all took about 10 minutes. I thanked him for listening, and he examined me briefly. He seems to do the Valsalva maneuver a little differently. I was lying on my back, and I think he folded the scrotum up on my body and asked me to cough while pressing the veins against my body. Normally it's done standing up. The pain was alarming and sharper than normal, more in the testicles than the normal general pain I feel throughout the abdomen. It also seemed to flash through the cremaster and the inguinal canal and into the abdominals as well, more on the left than the right. As I write this out, I really remember mainly the pain when he did the left side. The middle between the pelvic bone and the belly button hurt sharply. Often this pain is more dull, but he didn't ask me about any of this pain, so I expect that he was focused on evaluating the blood flow. I strongly suggest, if you don't understand this, that you read his PubMed paper on varicocele, the diagnostic dilemma. There's a link on the Mount Sinai Clinic staff page. So he explained that it was a varicocele and talked a bit about each testicle. He was so matter-of-fact about it, and I was so nervous that I had to clarify if he was talking about the left, right, or both testicles being varicose, and both were. You have to understand the importance of this issue for me, because in Manitoba I had been told that I do not have a varicocele or urological problems. The psychological stress of this was incredible for me. This is why I'm doing these videos. I believe that there are other men out there who have all kinds of back pain and disability because of the varicocele and are being told that their problems are psychological. Dr. Jarvi did none of that. He explained the surgery just as I explained it in the introduction. I asked if he could repair the hernia at the same time, and he said he could not because they're embolizing the veins. So I'm not going to get into that now. He said that the surgery would be done by the radiologist. I mentioned the Venogram in video 1, going from one testicle to the other, and asked if this surgery would work on this type of problem. He acknowledged the problem of collateral veins being missed and said that they sometimes even go through the prostate. He said that they would do a venogram just before the surgery and use it during the surgery to guide them to these collaterals if that was a problem. I said that I understood that he was saying that embolization was the best chance that I had, that he could not do microsurgery because of the scar tissue, and that I would want to go with his recommendation and have the surgery. So he said that we would need to do an ultrasound first. I thanked him, and that was the end of the appointment. I'm currently being scheduled for the ultrasound here in Manitoba. So if you have a varicocele and you have pain, or if you've had inguinal surgery and it failed, I really haven't heard anyone describe their problems to me in this sort of detail, and research on varicocele pain is very limited. I've put all this literature up to help you. I won't share any of your information specifically on here, but I would really like to hear the kind of difficulties that your varicocele is causing you. I think that there's a lot of denial going on about this issue in urology. Maybe you are suffering too, and we can help get this issue more researched and talked about. I think that it's going to help us more to get things done. And you can see on my, you can go to varicocele surgery failure part 2. I'm updating the table of contents as it goes, and I want to next do a a video series on varicocele pain syndrome. I think that urologists need a study on evaluating the men who have pain from varicoceles. 30% of varicocele surgeries are for men having pain, but there's very little criteria talking about what kinds of pain the men have. So anyway, thanks for watching, and I'd like to hear from you if you have similar problems. Thanks a lot. Bye.